Thank you everyone. It's been a wonderful day and a half, 2 days and a half for those of you that were here last Wednesday for the Climate Pre-Symposium. And this has been, as Anna said at the beginning, the fourth symposium that we have done here, 2015, 2017, 2019, and now 2025. One of the things I will say on a personal note is that I came to the first one, 2015, as a doctoral student. I was at that time in Baltimore at Hopkins. I came with Manuel, who's over there, who was coming from Spain. And then I came to the 2017 one. I had already started here at Drexel as postdoc. I was still living in Baltimore, so I was still commuting here. And then I came to the 2019 one. I think I had just started my tenure track position back then. Because I think it started sometime in that year. So it's wonderful to see this one, and especially to have seen a little bit of how the thing gets done. And I think it's been a wonderful experience, but most of all, it's been a wonderful experience to hear everything that people have shared during all of these days. Starting with the panel of health commissioners, I think that's something we've been doing in every single symposium, and I think it works really well to start that way, because it really grounds us in the ground, literally, and in reality, and in the people that are actually doing public health, so that it frames the rest of the conversation around that. Then we had wonderful sessions on climate. We closed a little bit on climate here, which was great to see, as one of the biggest threats to public health that we have. We also had a session on novel data methods, which I haven't been to a scientific conference in the last 2 or 3 years, because with toddlers it's hard to do. But it was like being back at SCR in my case. It was very exciting. Also had a wonderful poster session. I want to thank all of the poster presenters and also the poster reviewers. You can find them on the program there. It was great to see everyone there, and also to celebrate the 10th birthday of the UHC. I'm realizing we didn't sing Feliz Cumpleaños to the UHC, but we can do that some other time. And also the 2 keynotes we had both yesterday and today, with almost 2 generations of New York City health commissioners, which is great to see also how that. And then also today in policies and interventions, a great panel with very different types of interventions, some commonalities, but also some of them tackling very different things. And something I will say, I wanted to ask that question before. I ended up not doing it, but since I have the mic now, I can just think about that, which is that it always strikes me as in public health, we want to show the benefits of all of these things, but I think it should be obvious that people need resources to live, should be living in beautiful neighborhoods, should be having public transit to go wherever they want to go, etc., etc. And this just shows that all of the hard work that we need to do to really prove that. And I will close here by saying that I want to thank again the school, the university, and everyone that funds the work of the UHC, including the dorm sites of all of our funders. Also the organizers of all of this. I want a round of applause for Claire over here and Derek back there, who have done a lot of the amazing work that got speakers here, people here, food here, things in the poster session yesterday. Also, everyone else at the UHC that has worked in this, Autumn, Will, Eric, all of the volunteers that you have seen doing things around, taking pictures, posting them here and there. We'll eventually be posting the recordings of this somewhere at some point. We will let you know. I also want to thank especially the presenters, all of the panelists and everyone, and the moderators, because of course this is a symposium, so none of the work can happen without that. And also, finally, a reminder to all of the trainees here that, as you have seen, and I think heard now, and heard in all of the other sessions, public health and urban health specifically, it's very well needed. We need well-trained people that can help improve the health of everyone in cities, that can help reduce health inequity, that can help protect populations on the threats, inequality, climate change, violence, war, etc., etc., and that you are needed to do this. and that, we are in an institution of higher education here. It's one of the ones in Philadelphia that trains people. Whether you are here or are away in other places, please continue all of this hard work because public health should continue to do this kind of hard work, even though there's a lot of people out there, especially now in positions of power, that do not want that to be done. So please, persevere, and I think that will be for the betterment of all of us. So thank you.